A safe and effective vaccine may be the most effective way of ultimately ending this pandemic, but that's assuming that people will take it. Recent polls show some real concerns about the vaccine, despite the assurances from the scientific community about its safety. Will Carr has more.
As soon as April, the vaccine will be available to the entire general population.
With vaccine authorization expected soon, the biggest challenge moving forward may be injecting Americans with enough confidence to take the shots.
We get vaccines to the American people and they don't take them. Shame on us. Hey, I was already sick. I don't need it. Shame on us.
Many are wary of the vaccine's unprecedented speed. Others are polarized by politics. With the election now over, a recent Gallup poll found that even after nearly 250,000 Americans have died and many more have endured restrictions and shutdowns, 50% of the country still does not want to take the vaccine when it becomes available. That includes Irina Barlage, a physical trainer in Los Angeles.
I personally decided I'm definitely not going to take it.
No matter what, you're not going to take it?
No matter what. I believe I'm a healthy, strong person. It's relatively new. I'm in general a little skeptical about what I want to put in my body.
Barlage is not alone. She says most of her colleagues and clients feel the same way.
We honestly have a vaccine confidence problem in this country. We have huge parts of this population that just do not trust the manufacturers of vaccines. Even in a good year for the flu vaccine, we only see about half the population getting it. And the flu vaccine is a really well-studied vaccine that we know is incredibly safe.
The fear of the vaccine comes with the reality of rising COVID numbers. Cases are jumping across the country, including in Los Angeles County.
And much of the nation has been experiencing a significant increase in cases and hospitalizations.
Dr. Jeffrey Gunzenhauser, LA County's chief medical officer, says an effective vaccine could be the cornerstone to reopening many shuttered businesses. Would you be willing to take the vaccine?
I would say I will do what I hope everyone does, and that is I will look at the information that's made available, and if it looks to me like it's safe and effective, I certainly would be glad to step up and get the vaccine and show people, as an example, hey, I'm getting the vaccine. But it is an emergency use authorization. It's not a fully approved biologic, so there is really that need for each individual to be fully informed about what it's for, the benefits, the cons, what's unknown about it, and realize they have a choice whether to do it.
With COVID numbers spiking, the vaccine could be available to some as early as December. Medical professionals tell ABC News the vaccines appear to be safe and effective.
Indications that we've seen is that the companies have been incredibly vigilant about maintaining sort of the integrity of the process of clinical trials when it comes to vaccine. There's no signs of any cutting of corners. We have not seen anyone cutting corners. In fact, we've seen the opposite, where companies who have identified adverse events have paused trials to investigate. My plan is to take the vaccine when it's available to me. I work at a healthcare organization, so that they will decide when it's time for employees of our hospital to get the vaccine. And yes,
Dr. Anthony Fauci is making it clear that once the drug makers get approved by the FDA, he's on board.
If they look at this data and they say this data is solid, let's go ahead and approve it. I promise you, Andrea, I will take the vaccine, and I will recommend that my family take the vaccine.
As the country waits for answers, individual states are now scrambling to prepare for the vaccine's rollout, some stocking up on ultra-cold freezers for storage. As the country waits for the vaccine, cases have jumped here in Los Angeles County. They've been forced to extend the hours for testing here at Dodger Stadium. And here in Los Angeles, more than 32,000 people are being tested every single day, a number that continues to go up. Lindsay.
Will, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.